Surgeons, what was the biggest mistake you made or oh shit moment while operating on a patient? I was doing a corneal transplant when I had the oh crap moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off, but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say, oh crap. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 0 nylon sutures, which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. Story 2. Malpractice stories can be tough. I'll lighten the mood a bit. Was doing varicose vein surgery on a very posh middle-aged lady. Very cut-class accent. There was an anesthetic that we used that sometimes induced some hallucinations, either going under or coming out of anesthesia, and heard some funny things. Anyway, this lady was in recovery just coming out of the anesthetic. The team were around waiting for her to wake up and gag a little on the tube in her throat for breathing, so we knew it was time to remove it. She gagged, we removed the tube, she smacked her lips and said loudly, in her incredible accent, "That's the best bit of banana I have had in years." The whole recovery room just fell about laughing. Luckily, she didn't remember it. Story 3. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night. Intubated, breathing tube in, sedated, Foley catheter, tube in pee-pee hole, and all. Long story short, he was extubated, breathing tube out, that same shift, and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis and was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been emptying my whole shift, which is normal seeing as how he didn't make urine anymore. And this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I de-inflated the balloon, removing 10 milliliters of saline and pulled it out. As soon as the catheter left his pen, blood started pouring out. Turns out the nurse who placed it on admission hadn't advanced it far enough since there was no urine production to indicate correct placement and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's pen shut to put pressure on it while my coworker paged the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's pen in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour, total, I held this man's banana and tried to make polite conversation until the urologist arrived. Story 4. We're all like, his glasses spontaneously broke in half. They were the type that didn't have rims, just lenses with a bar across the nose and bars for the ears. So the metal crossing the nose snapped at the screw. Surgeon quickly starts stripping off his gown, etc. Had the full face shield get up, ortho-ors are splashy, and leaves the room. Comes back with a roll of tape. Him and the circulating nurse can't get them fixed, so he just holds them to his face and has her run the tape around his head a few times. Then suits up again and goes back to acting like nothing happened. All in all, added like 10 minutes to surgery time, at least that I could catch directly. I hadn't been with that surgeon before, but I can't imagine that was his best performance afterwards, seeing as how his glasses were taped across his eyes at weird angles. But yeah, don't buy $5 readers for. Commentaire? Med student here. I was watching a knee operation when the surgeon suddenly stopped, looked towards the staff, absolutely shocked, and asks, "This is the wrong knee, isn't it?" Basically, he was told to operate the wrong knee and hallway trough. He realized it was too good-looking to be the knee that needed the operation. Luckily, there was no permanent damage done. The team reknit everything together and rescheduled the surgery. Story 5. Not a surgeon, but I had a screw put in to hold together a fracture in my wrist. At the last moment before surgery, the anesthetist told me I could have the surgery with a local rather than general anesthetic as planned. So I let her make the call for me to be awake. During the drilling, my surgeon started complaining at length of why he hates the drill he's using and how it's inferior to the other type or brand. It was apparently the only one he could find at the time, and he didn't want to reschedule. Once the screw is in, the surgeon says to close up. Someone asked if the screw should protrude as much as it was, to which he responded, No, but we can get away with it, and you never want to take a screw out and put another in as you essentially wear the thread of the bone. Then silence for about 10 seconds while I feel them shifting wrist around, followed by, actually we better put a smaller screw in. When I was in recovery, the surgeon was surprised how quickly I woke up and had a slight look of surprise when I told him I was only under local. Next thing he said was, surgery went well. Story 6. Not a surgeon, but I am a histotech. We work in the pathology lab where all the specimens are sent. A surgeon did a double mastectomy based off a different hospital system's pathology report. Basically, the report said she had the kind of breast disease where both breasts need to be removed. But we found 0 cancer in either breast. He was crafting bricks, so we submitted both breasts in their entirety. That's a ton of blocks, and it's unheard of to submit all the tissue like this, but he needed to find cancer. I've never seen a surgeon stand there and watch the pathologist like this guy did. We all felt so bad for him and OFC the patient. He was so upset, cussing up a storm the whole time and screaming about, "This is why I never take outside pathology reports." It turns out the other lab had mislabeled her specimen, so some other lady got the all clear who had cancer and she lost both breasts when she didn't. All around horrible situation and the surgeon was sick over it all. Commenter, it happens all the time. I also work in a pathology lab and I spend multiple hours every day contacting nurses to solve mistakes that they made, we caught. So many things come to us mislabeled or not labeled at all and we just have to send them back. It's ruined any sense of trust I had in doctors to see all the silly mistakes they make constantly. Story 7. Veterinarian here. We do quite a few surgeries, so I hope this counts a real response. Mistakes likely happen all the time, from nicked blood vessels to skin. Most are probably fairly minor. In the veterinary world, I've certainly heard stories of male animals having an abdominal incision during a neuter since someone thought it was a female for a spay. Surgical instruments and sponges, gauze, can be forgotten in patients. There are many pre- and intra-surgical checklists to help prevent these, and I am sure it is even more developed in human medicine. Fortunately for me, the biggest surgical mistake is probably a suture slipping when removing an organ, resulting in minor internal bleeding. Fairly easy to find the bleeder and get things stopped rather quickly, or having a small bone break when repairing another fracture. Things happen. We address it and learn from it for all future patients. Story 8. Not a surgeon, but was working in obstetric theater in UK mid-heatwave last year. This is important as maternity wards are kept quite warm, as newborn babies aren't good at regulating their temperatures. Combine this with a heatwave and the fact that in Britain we're not exactly used to high temperatures, and we have the perfect storm. Mid-emergency caesarean, the scrub nurse assisting the op starts feeling faint. This is unusual as the scrub nurse worked in these theaters full-time, so this was her bread and butter. So I can only conclude it was the heat. She has to step out, so the show takes her place, assisting the OBS registrar with the section. This show looked extremely junior, as in first section ever, and they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theater gown to stop them face-planting the open uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. Story 9. My mother's surgeon. Well, not doing basic math correctly and sewing up a woman having spine surgery with 2 sponges still inside of her. My mom was 20+ years sober, so she refused most of the pain meds. When they had to confess, they ducked up. She had a mental breakdown facing all that pain again. She got a lawyer and they settled ASAP, about $50K. Mom thought that was fair, but my godfather is a retired federal prosecutor and said it would have been $100K easy with another attorney. Update. Want to thank everyone on behalf of my mom for the good thoughts. This happened about 15 years ago. My mother has a master's in biology and knows, well, crap happens. It's a testament to her character that she decided the settlement was fair for an accident. Yet another example of how extraordinary my mom is and how underappreciated this retired HS biology teacher remains. Story 10. Not a surgeon, but I can tell you of one. My mother-in-law had a bad fall while on vacation in Florida and had to have hip surgery. They nicked her bowels without realizing it until almost 2 days later, when she started complaining of abdomen pain and her blood pressure started dropping. By then, she was already septic, went into a coma, and they couldn't save her. The hospital declared her death natural causes. We only know otherwise because my husband's family hired someone to do an autopsy before they cremated her body. Story 11. I'm not a surgeon, but am a nurse. We were doing an APR for a patient with rectal disease. Quick summary, you remove the rectum, close the anus, and the patient has a colostomy for the rest of their life. This procedure was done robotically. The rectum was detached and wasn't immediately removed. Not uncommon. I went to lunch, and when I came back, noticed the lack of specimens on my table. The patient was already closed and minutes away from being extubated. The surgeon had to return to the OR, reopen the patient, and remove the specimen. Big deal, but luckily no real harm to the patient. Story 12. I've already wrote one, the one about the knee surgery. But here's another. This one is not a personal experience, but a case that I read and stuck with me. So, a surgeon removed the healthy leg of a 52-year-old instead of the other diseased leg. He was already cutting the wrong leg when a nurse looked through the patient's file and stopped informing him that he had been working on the wrong leg. Apparently, the surgeon denied responsibility for the error and shifted it to other staff members involved in the surgery. Since the blackboard in the operating room schedule, and the hospital computer all listed the wrong leg for removing. Also, the wrong leg had also been prepared for surgery prior to the doctor's arrival. The surgeon added that he didn't realize that he was cutting the wrong leg because it was also diseased and might have needed to be removed in the future. Story 13. 13 years in practice as a surgeon. Thus far, so myself haven't had any major operative F-ups. However, everyone who is a surgeon gets their training at some kind of academic medical center. The mentors at these places tend to be of two varieties. Type 1, the highly competent role models, and Type 2, surgeons just barely competent enough to stay in practice, but with their mistakes frequently reviewed publicly for educational purposes by the trainees who also work at the same facility, so they can call those of Type 1 for rescue help during the operation. By far, the most common mistake made by Type 2 surgeons is doing operations in patients that were beyond hope of recovery. This frequently results in suffering for everyone involved and many times a more expeditious death for the patient with a terminal illness. A good example would be attempting to resect large, unresectable, wrapped around sensitive vital structures. Some Type 2 surgeons make careless mistakes, like how I watched a vascular surgeon that forgot to reverse the vein graft when doing a bypass, so that all the valves are pointed the wrong way and the graft doesn't flow. I also once saw a cancer surgeon use the ultrasonic dissector to accidentally divide the external iliac artery. Have heard about inadvertent vascular injuries to the iliac vein and aorta? All but the last of those were identified and corrected, with the patient suffering no adverse consequence. Lots of times, bowel injuries are missed, and the patient has to go back to surgery for a resection or repair. That's super common because the bowel is pretty thin and fragile, and partial thickness tears can break down in unhealthy patients with a lot of previous surgery and lots of adhesions. Even great surgeons get leaks once in a while for all kinds of reasons, but most commonly overconfidence in a really sick patient's ability to heal a technically proficient surgery. Sometimes timing an operation or part thereof is the most critical thing. Having good enough blood pressure, heart rate, oxygenation, and nutrition are just if not more important for some types of surgery, where functional organs are reconstructed rather than just being removed. There are some common sayings among surgeons, and one of these is, it takes 5 years to learn how to operate, 10 years to learn when to operate, and a lifetime to learn when not to operate. Story 14. A long time ago, I worked for a law office as an administrative assistant. The office represented doctors who were going in front of a medical board to defend their licenses when they were accused of violating medical conduct. There were surgeons who routinely left items in their patients over and over again, who kept getting let off. A doc who was forging paperwork for parents to show that they provided services to their kids when they were never provided, which caused an outbreak of disease and resulted in innocent people dying. There were doctors who were using their medical knowledge to poison family members. I obviously can't go into any detail, but that crap was terrifying. Most of them kept their licenses and faced no recourse besides losing a little money in a malpractice suit and getting their malpractice insurance raised and occasionally paying a fine to keep their license. There are a lot of good doctors out there. These were not them. Scary outcomes. Story 15. I'm a patient, but I'll tell you my story. Went in for an emergency appendectomy. Woke up and could never go #2. Turns out the surgeon injured a nerve which caused my bowel to be paralyzed. I was on 5 laxatives a day for several years with no relief. My guy doctor told me I'd be lucky if I could one day go to the bathroom once a week. Story 16. Surgery resident here. For the non-medical people, a doctor who's in middle of a 8-year surgery training after med school. This is not my mistake. I was not scrubbed in this case, but a mistake of a mentor of mine who I consider one of the best surgeons in terms of surgical technique, warm bedside manner, and as a teacher. A healthy young patient with acute appendicitis booked for laparoscopic appendectomy. This is a minimal invasive operation, commonly performed every day, for removing the appendix through 3 small 1 to 2 centimeters, followed by placing special ports through incisions to allow laparoscopic instruments to go in your belly. Before placing the ports, we inflate your belly with CO2 like a balloon to make space for the trocar ports. Each of these trocars have a pointy javelin-looking thing so it can enter the abdomen. The first one goes around your belly button. The second goes somewhere below the belly button a few centimeters. The third one goes somewhere on your left side of the belly. In my mentor's case, the first port went in smooth, but upon placement of the second port, the trocar, a javelin-looking thing part of the special port, went through and through the crotch of common iliac artery and also into the left iliac vein underneath it. Vascular surgery was called in emergently. The abdomen was opened up the old-fashioned way via laparotomy, vertical incision, and vascular team tried to repair the injury. The patient coded from massive blood loss and eventually died after many hours of CPR, resuscitation, and transfusion. The loss affected everyone in the surgery department, not just my mentor. It was devastating. Edit. Thanks for the silver. Wow, first time getting it. Story 17. I am not a surgeon, but I have a story of this. May 27th, 2020. My grandson goes to his ent doctor's surgeon for his surgery to have a cyst removed from his thyroid gland. Because of pandemic, my daughter-in-law had to wait in the car in the parking lot. Simple surgery. Go in the morning, go home in the afternoon. An hour later, my son calls me. He's the dad. Something went wrong, and my grandson is being rushed by ambulance to the local hospital with a children's wing. The damage was so severe that the surgeons there didn't know what to do. The original surgeon had cut vocal cords, and he cut a hole in his larynx. They called to talk to experts at Seattle Children's Hospital. My grandson has been sedated and ventilated the entire time. The following day, the doctors recommend my grandson be flown to Seattle Children's Hospital. Mom gets to fly with my grandson. My son drives over by himself. They arrive Friday morning. The new surgeon does the 6-hour repair surgery from 5:11 p.m. Friday night. My grandson spent the next week under sedation and on the ventilator, and then the new surgeon opened my grandson up and told my son and daughter-in-law that everything looked better than he had even hoped for. The surgeon had 3 goal priorities. 1, that my grandson would be able to breathe on his own and not need a tracheotomy. 2, that he would be able to eat and swallow on his own. 3, that he would still have his voice. After 2 weeks in Seattle, they came home, and my grandson is doing fantastic. He does have to go to Seattle to see his wonderful surgeon every few months to have scar tissue SCD from his vocal cords. But he is doing awesome, and that surgeon succeeded in meeting every one of his goals. 2 other items. My grandson has wanted to be a voice actor since he was 4 years old. The original surgeon that messed up called my son and told him that once he opened my grandson up, he saw that it was not a cyst on his thyroid gland, but a lymph node. Yet he continued to perform the surgery. Yes, my son and daughter-in-law have a malpractice suit against this doctor. Story 18. Not a surgeon, though I'd share this thought. Husband went in for a routine colonoscopy, and as they were prepping for him, anesthetist asks him if he's a ginger. My husband tells him, yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, okay, I gotcha, we'll give you the Redhead dosage, and winks. Well, my husband thinks it's a funny until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke, and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage, and he still woke up. Happened a couple years later. They gave him ketamine and some other crap to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. Story 19, asterisk, not a surgeon. But my mom had to have a mastectomy on her left breast. They were getting her ready and came in saying, okay, so we're going to remove the right one. And we are like, no, the left. The nurse goes, oh, hold on, and cue 15 minutes of endless right, both left and several different nurses coming through. Finally, the surgeon comes and is like, left. The same surgeon told her the tubes they put in for drainage would be removed by the time she could go to work in a month. A resident came one day after the surgery, toward the end of the day, told her he was there to take the tubes out. She said no. The surgeon said it would be a month. He pressured her, took them out. These were stitched to hold them in place. The next day, she is in so much pain, and her chest is swollen and hard. They call the surgeon, and he comes in without the resident that had been following him around. He's like, what happened? He's pissed. He drains her and is like, we have to get the fluid out, and says to try it one way since they can't go back and insert the tubes. Christmas Day, he is in his office draining my mom's wound, but he's telling her what else to try to help the drainage. He had his resident apologize and laid into him, then said, next time if there is a question, everything stops till you hear from the doctor in charge. I had a minor one. I was having a root canal and had sudden pain. Apparently, I had 5 roots instead of standard 4, and it was visible on one x-ray as a thickened root, and another angle you could see just barely the 5 merged into 4. Nothing major, more pain-numbing and extra time, but he kind of shook his head and said weird. Not the first time a medical professional has said that to me. Story 20. Not surgery, but perhaps it's less shocking because we have a more chaotic environment, but I have lots of stories. Many years ago, trying to straighten out some fractured forearm bones, I managed to dislocate the wrist. The patient was very likely headed to surgery anyway, but I tried so hard that I made it worse. I've given activated charcoal to an overdose patient that then progressed to needing intubation, much more difficult to do when everything in the back of the throat is pitch black. Sometimes one injects too much local anesthetic, and it distorts the tissues, making it more difficult to close a laceration in the best cosmetic way. It's a fine line listening to the patients that always want more painkiller. but also want a pretty result. I once saw a kid with a runny nose the night before his parents had tickets to fly to Disney. Silly me, I examined his ears. Although no ear symptoms, he had a bright blue piece of plastic in his ear. Therefore, I felt obligated to get it out. Kid is not cooperative. Sedation. Lack of success. Multiple docs tried. In this situation, we usually discharge to go to Anticoagulant tomorrow, but they had morning plane tickets. I don't recall if they rescheduled their plane tickets or went to Disney with asymptomatic ear plastic, but after hours and hours fruitlessly messing around with me, I feel I probably ruined their Disney trip either way. Story 21. Surgical ward nurse here. Worst I'd seen was a bloke who'd managed to get to the operating theater for inguinal hernia repair, but had completely forgot to tell, and no doctor or nurse had bothered to ask about his medical history. Otherwise, young, fit, healthy bloke, so no recent blood work had been done either. Within a few minutes of returning to ward, his surgical incision was starting to fill. It almost looked like an IV drip had tissued, and his lower abdo was filling with the IV fluids. Rather than go into the veins and around the body, bagged fluids starts filling up the surrounding tissue, etc. But of course, no one put any fluids down there. I was still a grad then, but I'd seen enough post-op hernias to know something wasn't right. I called the on-call doctor, who at the time was only a medically trained junior. He took a cursory glance at it, told me he wasn't a surgeon, was probably some local anesthetic, and said he had another real emergency to go to on the med floor, but would come back to check on it after that. I just knew something was terribly, terribly wrong and started an almost police-level interrogation as to if there was something he might have forgotten to tell the doctors. No judgments, etc. I needed his 100% honesty. I could have used the Chris Pratt meme when he admitted he had a condition called thrombocytopenia, but he didn't know what it was and was too afraid to bring it up, and just assumed the doctors, etc. somehow know. I then called the doctor back immediately and told him with or without him, my next call would be to transfer the patient immediately to our Department of Emergency. The doctor was obviously happy with the same and told me to do what I needed to do. Still had his emergency, but would verify any highest level transfer request, etc. I'd make. Thankfully, we caught it quite quickly, and he only needed a couple bags of blood and some medication to restore hemostasis, normal clotting, etc. He was apparently discharged home safely the day after. Custodium. Patient didn't tell the surgeons he had significant bleeding problems, and no blood work was done, which would have instantly flagged it. Got a decent surgical incision, as intended, and his lower belly started to fill. Story 22. Not a surgeon, but a few years ago, my mom had a major stroke, which left her on a permanent feeding tube placed in her abdomen for about 3 months of her recovery. I will say she got the absolute best care other than this incident, and she had a miraculous recovery, to quote the doctors. When she had the feeding tube removed from her abdomen, we weren't worried, because it's a fairly simple procedure from what we were told. Then my dad goes to change the bandage when the time comes, and what else does he find? But a string sticking out of my mom. So, he called the doctors, thinking that probably wasn't right, and they very quickly got her back in to remove the pieces they left in her. My dad taped the string to a sticky note and hung it in the kitchen. He said he'd file a lawsuit, but nothing yet. I think he was just glad she's alive, and tired from all we'd been through. Story 23. Nurse here. I'll add for interested readers' sake some mistakes nurses have made that I know about. 1. Nurse places a nasogastric feeding tube in a comatose ICU patient for tube feeds. Basically, a tube through the nose down to the stomach so the patient can eat while in a coma. The nurse starts the tube feed before getting an X-ray to confirm appropriate placement. The tube was in the wrong place. Due to some major misfortune, the tube ended up on the brain. A nurse assisting in the imaging center obtained an order for an anti-anxiety medication called Verse to be given to a patient getting an MRI. This patient had issues with claustrophobia, so this was necessary to obtain good images with the patient. The nurse went to search for the drug in the Pyxis machine to override pull it because in the short term, ordered substances like this won't come up in a reasonable amount of time to wait for it to automatically show up under the patient's name. So she has to type it in like a Google search in the screen to pull the drug. She types in only V, which pulls up relevant substances by alphabetical order, and without looking, clicked the first drug and gave it to the patient. It was only when the patient died that they found out what happened. When she typed VE, the first drug alphabetically wasn't Versed, it was vecuronium. The difference being an anti-anxiety med versus a paralytic med, which paralyzed them while conscious and died. 3. A nurse went to change a surgical dressing per order and misunderstood the order for how to dress it. She then recovered the wound with a cover dressing, which the night shift nurse didn't check, because the dressing wasn't ordered to be changed at night, and there was no reason to look beneath it. It wasn't noticed until the next night because the next day, Shifterin was busy addressing emergencies and ran out of time to change it, so the night shift nurse stepped up and found the wound dehisced. Story 24. I replied to one of Op's comments further down, but reposting in the general thread since it's a serious response. I haven't worked in a surgical setting, but I did work as a firefighter, EMT, for 8 years. The worst error, mistaken judgment I witnessed was a paramedic delayed the transport of a critical PT by 40 minutes because they could not get a A-tube intubation on a patient. The patient's airway was compromised due to head-first fall off the rafter of a garage he was building. But we had a secondary option for airway protection called an IGOL. It is very easy to insert and should have been resorted to due to the PT's condition. Unfortunately, the paramedic chose to attempt the ET tube intubation 6 times. Our county protocols only allow 2 attempts, before finally letting a life flight paramedic who had arrived on scene make an attempt. This paramedic was also unsuccessful and resorted to the IGEL immediately. No idea if the patient made it or not, unfortunately, but the paramedic got in a bit of trouble over this call. Story 25. Late to the thread, but yeah, surgery is a tough line of work. There is no procedure in medicine with 100% success rate. It just can't exist. So you're going to fail. Sometimes it'll be your fault. Sometimes it'll be bad luck. I do surgery with PTs under conscious sedation, so lots of them are awake enough to move around, meaning sometimes it's actually their fault. Though that is always on me. They should have been deeper or perhaps under general. Comes with its own risks. Or maybe not as deep so they were more in control. But many people fear this. It's a hard line to walk, and complications always hurt unless you're a psychopath or delusional. The bulk of what I do is cataract surgery, which has a 0.05% complication rate nationally. Very low, but I do about 700 a year. The math on that means that if I'm very, very good, I'm still seeing 1-2 complications a year. Can range from mild and manageable to needing a second surgery to having permanent vision impairment. True blindness is virtually unheard of, luckily. Regret and personal failure stings like hell. I've taken to journaling my complications when they happen so that I can hopefully learn something and get better. What could I have done? What did I do right? How to mitigate or prepare for next time. But ultimately, we're fallible. Some patients are understanding, some are not. Some want to sue you, some want to harm your practice. Some mellow out with time. Some are very kind. To answer the question, I've put the wrong power lens implant in a PT's eye. My tech took the measurements in the office while the PT was wearing contacts, not with them out, as is standard. Still my fault even though I wasn't in the office that day. Should have trained them better. PT was chill, went back to the OR a week later and swapped out the lens. Not a huge deal. She did great. Other complications have resulted in worse outcomes. Infection can be very bad, but isn't really anyone's fault. But that was my biggest personal mistake. Story 26. In Japan, heart surgeon. Number 1. Steady hand. One day, Yakuza boss need new heart. I do operation. But mistake, Yakuza boss, die. Yakuza very mad. I hide in fishing boat. Come to America. No English, no food, no money. Daryl give me job. Now I have house, American car, and new woman. Daryl save life. My big secret. I kill Yakuza boss on purpose. I good surgeon. The best. Story 27. Not necessarily a mistake, but a weird oops. I was the patient. The day I turned 14, I had an ovarian cyst rupture. They took me to a children's hospital and they decided on surgery because I already had horrible pain on that side and it looked a tiny bit deteriorated. I had an uncle die from a ruptured appendix and they didn't want any risks for me. When they removed it, they used a surgical staple to close off where the appendix was attached to the colon. The problem was, I actually had PCOS and was diagnosed a day later, so multiple ovarian cysts showing up and pushing on stuff in my abdomen was going to be a regular problem. 7 years later, horrible pain, bunch of cysts again. I get taken out of college and rushed home for surgery with my obgyn thinking it's endometriosis or something. Nope. It's the staple from my appendectomy in the middle of my gut floating towards my stomach. She later figured out that this was actually a reoccurring issue, especially for women who had PCOS or who were younger. In a few cases, she found they ended up migrating to the skin and trying to come out of the body. It wasn't malpractice or a true mistake, just what they used at the time versus what they would have done now. My obgyn had some choice words regarding the previous surgeon's decision because I was her third patient. In 5 years, this happened to. Story 28, not a surgeon. I was the patient, but I was close with my surgeon and his PA. I was in an ATV accident and shattered my humerus. About 5 months later, delayed due to a staph infection, it was decided by my ortho to insert a plate, screws, and cables. 2 months prior, I had a bone graft to try to repair it so I wouldn't have to have hardware for the rest of my life. But it didn't take like my ortho wanted. I had been in a sling and splinted from shoulder to fingers for this entire time. Surgery goes well and I start PT to regain muscle. I go in for a checkup about 3 months after starting PT and they do x-rays. Ortho comes in and we're looking the x-rays with his PA and he freezes. He points to the x-ray and tells me that I need a third surgery to repair my arm. Due to the atrophy, he wasn't able to extend my arm during the plate placement to test it to make sure it was high enough. Turns out the placement was too low, and as I was extending my arm, it was knocking the plate out of the bone. I cried when he told me because I just couldn't stand the thought of going through that pain again, and he apologized multiple times and told me he was there if I needed anything or had questions. My mom was friends with his PA, and she confessed that after I left, he went to his office and cried because he didn't want me to have to go through the surgery and healing all over again. He referred me to another ortho, and the surgery went well to move the plate and add another one. I saw my original ortho a few months ago, and he saw my updated hardware for the first time. He cried when I told him my life was pretty much back to normal. Story 29. I'm not a surgeon, but I was a scrub nurse for decades. My worst moment ever was being told we had left an instrument inside a patient. Now that is our job. Count, account, count again, and repeat. I had always prided myself on knowing exactly where all my instruments were at all times. Now you have to realize we can have hundreds of items out, but at the end of a case, we go through the trays again and double, triple check. So where the bloody had it come from? Even our CSSD staff, Central Sterilizing Services Department, hadn't alerted us that anything was missing, so what the hell? Turns out patient hadn't been well post-op and had a barium x-ray. Barium was put into the bowel through a tube in the rectum, and the tube was then left in place, clamped, and the clamp placed on the abdomen. Cover said patient with a sheet whilst x-ray was done and hello one clamp showing on x-ray. I saw the film and it was scary, but the surgeon and I said straight away it wasn't one of our surgical instruments, and if they had just showed us straight away, we could have avoided the panic. Poor patient was even told. Brought to theater for removal of the clamp, they were delighted to be told what had actually happened. A day we never, ever forgot. Story 30. I am actually quite poor IRL. A nice internet friend of mine was kind enough to share some awards with me, which was extremely nice of them. Will not disclose the names so they don't get spammed, but I hope this clears things up. 2020 was a tough year, and although I usually am unable to give, for once I can. All replies to this comment get a gold. Stay safe, Redditors. Story 31. I'm not a surgeon, but when I was in med school, there was an oh crap moment for everyone, including the surgeons, anesthetists, nurses, and students. They were prepping a patient for surgery and put him under, and the nurse said, okay, he's out, before they were about to start slicing him open. The patient just had enough strength to move his head from side to side and said, no, I'm not out yet. Everyone laughed it off, but if the patient didn't do that, it could have ended badly. Story 32. Not a surgeon, but I remember my friend telling me of her father's stomach surgery or something. They left a sponge inside his stomach. I forgot when they realized they did, but I do know her father is better now. Story 33. Not a surgeon, but my mom told me the story of how I had to surgery after I accidentally cut my eye open with a stick and my doctor was trying to fix my pupil. Apparently, my pupil was in the shape of a football and he tried to make normal. But instead, he ducked up and it made my vision worse. Now because of that, my vision is 21/100ths in my left eye and it can't be fixed. Story 34. Obligatory, not a surgeon. However, I have been a patient. After a heart op where they went in through my femoral artery, they forgot to tell anyone outside the theater that they had given me anticoagulants. Long story short, when I got back to the ward, my mom and dad came to visit and see how I was doing only to walk into the room from hell. I had 2 doctors and 2 nurses around me caked in BD with the back wall of the room dripping with it. I should have been in this tourniquet-esque thing for like 12 hours minimum. But they removed it and asked me to get up and move around after 4. Suffice to say it wasn't pretty, and the first nurse, the one to remove it, went absolutely white. No one answered the emergency buzzer for about 10, 15 minutes to help her. She just kept panicking and saying, "You're passing out!" Oddly, I was completely calm and kept offering her advice. I think it was shock. I tend to get very analytical instead of scared. Story 35. I was working in an animal research lab, and my job was to make incisions and insert catheters into the hearts through the carotid artery. I had a defective catheter with a sharp tip, and somehow I managed to have the catheter exit the carotid somewhere in the chest cavity. I had to step aside for a more experienced surgeon to take over from there, because my confidence was shaken. Luckily, she was able to save the rabbit. Edit. For context, the research I was working on was for finding a cure to a disease called infective endocarditis. It's basically where bacteria get into your bloodstream and attach to damaged areas of your heart. It's extremely serious. Almost half of all people who contract it die, and it kills thousands of Americans each year. Animal research in the US is taken extremely seriously, and the process to get approval for even the simplest experiments using animals is extremely rigorous. Our rabbits were fully anesthetized during the procedure, given pain medication for post-op, and treated with the highest standards of ethical care pre- and post-op. Please, before you judge, remember that animal research has saved hundreds of millions of human lives. I have nothing but the utmost respect for the animals that help us to better humanity. Story 36. Not a surgeon doctor was the patient. When I was between 7 and 9, I had my first port put in. It's an IV catheter attached to the main vessels in the heart. When I woke up, I knew something was wrong. I have CF, so my lungs were horrible already, but this was way worse. I couldn't breathe and I was in so much pain. The doc thought I was just being a kid and not handling the pain very well. My nurse knew me pretty good, and after me crying and struggling to breathe for a few hours, she convinced the doctor I didn't normally act like that and something was wrong. He ordered an x-ray, and we found out the surgeon had accidentally damaged my lung when putting the port in, and my lung had collapsed. Ended up having a tube put in my chest. Story 37. Dad is a vet, and I've helped him on many farm calls. One time, we were pulling a calf out of a dairy that refused to push for who knows what reason, when suddenly we heard a nasty pop and saw her hip drop. I'm not sure exactly what went wrong, as this was a long time ago, and working with my dad convinced me not to go in the medical field for any reason. I don't mind blood and stuff, but the pressure would get to me quick even with animals where the consequences aren't nearly as dire. But I do know they had to put that cow down. After we left, my dad had to look at me and give me a hard lesson on accepting failure. You can hate failure, it can make you feel not good enough, it can tear you up inside and crush you. And nobody can tell you it wasn't your fault or can make you feel better about it. But at the end of the day, life goes on. And all you can really do is accept it and keep moving forward. Story 38. I had an ingrown toenail. It was supposed to be a quick fix. I was 14 and had my mom with me. They let an apprentice do the surgery and he goes, "Oh crap." The doctor in charge just laughed and said no risk, no fun. Turns out they ducked up my toe and I had to have 4 more surgeries to correct it. I cried. Story 39. During my 3rd year of medical school, I was stitching up the wound after breast surgery, and the anesthesiology nurse woke the patient too early as I was making my last stitch, and I felt the patient moving her arm and trying to sit up. Patients were still covered in surgery draping and cables and still intubated. Luckily, most people do not remember much from the first moments after waking up, but I got quite nervous from the patient starting to move. Story 40. When I was in pharmacy school, I was doing my internal medicine rotation in my final year. My preceptor and I were doing med reviews in the ICU when one of the pulmonary docs was basically like, "Hey, you want to see something cool?" They were trying to extract a foreign object from a guy's lung in one of the rooms. So we go in and watch for a bit. About 6 people in the room, tube down the guy's throat, little grippers at the end, 2 doctors watching a monitor and trying to control the grabbers and get it like a claw game. I watched for a bit, then after a while I lost interest and went back out to what I was doing. A few minutes later, I hear, "Got it. Cheers," from the room. Oh, it's a tooth. Dude aspirated to his own molar. Doctor walks out with his trophy in a jar and it's a completely intact tooth root and all. Story 41. From my days as a vet tech 20-odd years ago, small dog in for surgery, because he, if I remember correctly, hadn't peed for days but was otherwise healthy. Some sort of blockage that couldn't be handled in the exam room. So we get him sedated and prepped for surgery. Dog is splayed open on the table and his poor bladder was as full as the best water balloon you've ever seen. Except this is full days old urine. And of course, like a good water balloon, the slightest pressure caused it to burst all over teenage me and the good doctor. So I'm in shock, pee dripping off my face and covering my scrubs. No mask, face shield, etc. This was a vet office in Alabama. We don't need no stinking PPE, except I desperately need PPE at that moment. We cleaned up the dog, got the ruptured bladder repaired, and stitched him back up. I'm pretty sure that was the moment where I decided my childhood dream of being a vet wasn't quite as glamorous as I thought. Story 42. Not a doctor, but a patient. I had a shoulder replacement, and one of the doctors nicked an artery. They were panicking to try and find the nick, doing everything, and whenever they saw it, it filled with blood. At some point, he got sight of it and jabbed at it with the clamps and finally got it. Problem was, there's a cluster of nerves directly behind the artery. So after they fixed up the nick, they had to go through the process of checking if they damaged the nerves and if my fingers still worked. The doctor tells me he'll be telling that story to his students for years. Story 43. Med student here. I was going to be watching a procedure of a 60-something-year-old lady get her pacemaker leads changed on a Monday. Well, right before the attending began the procedure and she was still a little awake before the anesthesia was completely administered, she let everyone know that she had smoked substances the day before. The procedure had to be postponed to Wednesday of that week to let the substances get out of her system. Then, when the attending called the sister of the patient to let her know the results and any precautions they had to take, the sister asked the doctor if her sister could smoke again. Because the phone was on speaker, the entire room just facepalmed. Story 44. I had kidney operation when I was about a year or two old. The kind surgeon managed to stitch me up with a 2 centimeters long piece of tube still inside of me. When they realized, it was a bit too late. I was screened annually to see if the tube inside of me didn't cause any problems, which it did not for over a decade. Fast forward to me being 14 or 15, taking a piss and seeing something slowly slithering out of my peenie. My first thought was that it was a parasite of some sort, and I freaked. Doctors of Reddit, please search your patients thoroughly before stitching them up. Thank you. Story 45. I knew a surgeon who was doing bowel surgery. He has cut the bowels into two as part of it and needs to sew the tube that comes from the stomach to a stoma bag and sew the one going to the air closed. He then makes a few mistakes. 1. Instead of tracing down from the stomach to find which end to sew to the stoma, he tries to remember, guess. 2. He gets it wrong and sews the stomach end shut. 3. He writes down he has traced along to the stomach to GT the right end. 4. He refuses to scan the patient, PT, for 2 days when the PT doesn't poop into the bag and feels full. 5. When he realizes the problem, he lies to the patient. He says they need a second surgery because the end at the surface hadn't got enough blood supply. 6. He deletes the notes saying he'd traced from the stomach to the right end. 7. He doesn't go to the meeting where people discuss failed operations, in which you have to defend your actions to your hospital. Steps 1, 3, 5, 6, and 7 are pretty big deals, and step 2 is just a result of not doing his job properly in step 1. He still has his job, the Vespa-loving arse hat. Story 46. Not a surgeon, but I was standing in on a total hip replacement with the most innocent, charming, polite orthodont. Then crap hit the fan and the screw wasn't holding and his tool broke. He so elegantly says, "Well, damn me," and stops and stares in silence for about 5 minutes. After that, the rest of the surgery was hand me the ducking scalpel or hand me the ducking forceps or the 5x5. Every time I saw him after, I just chuckled a bit. Story 47. Obligatory disqualifies. Not a surgeon, but a story I know of one who was on the receiving end of one of these mistakes. My mom was a paramedic and worked with a guy who had laser heart surgery to bypass some clogged veins. He had to go under for it because obviously using a laser to reknit your insides is extremely painful. When you go under, to my knowledge, normally they sedate you and put you to sleep first, then paralyze you to make your muscles relax and easier to work with. Something happened with this guy's surgery, and for some reason he only got the paralyzing agent, not the sleepy painkiller stuff. So he was awake for the whole thing, but completely unable to communicate that to the doctors. His heart rate was higher than normal, but the doctors, I guess, considered that normal given the autonomous nervous system reaction to having a laser burning away at your heart. When they woke him up, he was furious and yelling at the nurses. The doctor didn't believe him at first and thought it was basically just a bad trip under anesthesia, until the guy recounted the whole operation and some of the conversations he heard the surgeons have, including their comments about his abnormally high heart rate. Story 48. Medical student. On my anesthetics placement. Went to see a patient due for surgery that morning. On my way back to theaters for briefing, the nurse comes running down the corridor to tell me that the patient had been fully anticoagulated the night before because the surgeons had forgotten to unprescribe it. If nobody had stopped us before we gave her the epidural, she would have bled into her spine and become paralyzed even before the surgeons opened her up. And that would have been even worse because had she bled, we wouldn't have been able to stop it. It's hard as a medical student to know your place. And when to speak up, you're surrounded by professionals. And when you see something like a full thudic dose of anticoagulants on the patient's drug list, you don't want to question it because surely everyone above you knows what they're doing. The consultant I was working with told me there have been stories of medical students not speaking up when surgeons have started operating on the wrong side, giving substances where it is contraindicated, etc. And they have known. Story 49, not a surgeon, but when I was in nursing school, I was observing a tonsillectomy when the power went out. Everything switched over to the backup generators except for the suction, which is incredibly important for any surgery, but particularly in the throat, aspiration risk. They ended up having to connect a giant syringe to a length of suction tubing to suction manually, while someone went to the other side of the building to find portable suction. Luckily, ours was the only theater that had started operating that morning. Story 50. I am a surgeon. My specialty is trauma, so I do very little elective surgery. My patients are often dying or severely injured, or are stable, but I'm operating to fix something that has been recently injured. In my specialty, a mistake is often looked upon retrospectively as a split-second decision that went the wrong way. And next time, you should choose option B instead of option A. As someone else mentioned, mistakes can be hard to talk about, but should be easy to admit. Otherwise, there's no opportunity to be better in the future. Any surgeon who says they don't have complications either doesn't operate or is a liar. I operate, and I am no liar. I have a collection of memories which allow me to be a better surgeon tomorrow than I am today. Surgeon René Lariche once said, "Every surgeon carries about him a little cemetery, in which from time to time he goes to pray, a cemetery of bitterness and regret, of which he seeks reason for certain of his failures." Story 51, not a surgeon, but a patient. When I was a kid, I often had surgeries to treat my genetic condition called osteochondromatosis. My surgeon came highly recommended, and although he didn't have the best bedside manner, he was very good at his job. I went in once to get some plates put in both knees to correct the bowing growth, and also to have a bone spur removed from my left foot. The surgery went well. I'm put in recovery, and my parents come see me. My mom, however, notices something strange. "Weren't you supposed to do both knees?" she asked my surgeon. I don't know his response was, as I was in dreamland, but I gather he was horrified. He'd done my right knee and my left foot, but had forgotten to do my left knee, which led to me having to undergo 2 more surgeries, insertion and removal of the plates in that knee, than I would have. He overall was a good surgeon. Still kind of upset about how he sort of misled us on the possibility of me developing cancer, though. Story 52, not a surgeon, but recently had surgery. When I woke up from my vertical sleeve gastrectomy, the surgeon explained that the stapling instrument had failed, and he had to close the stomach with stitches. I'm very grateful that my surgeon handled the situation and was honest about it. After all, it wasn't so much his mistake as it was an equipment malfunction. However, my husband, who was waiting for the "she's all good" call from the surgeon, wondered why it didn't come until like 90 minutes after it was supposed to. The operation was successful and resulted in a functioning gastric sleeve, even if it is old-fashioned. Story 53, not a surgeon. My son had open heart surgery for a VSD and foramen ovale. All went well, but one day the nurses said he was getting an infection, and they needed to take blood specimens from one of the many tubes he had in his inner legs. They did that, but before the results came back, they gave him antibiotics. Next day, they said, "Oops, there's another boy with the same first name that actually has the infection, not your son. So sorry, but antibiotics never really hurt." I was so livid. It could have been way worse, but still. Antibiotics are not something that should always be taken lightly. Story 54, spine surgeon. I was still a resident and was doing a kyphoplasty. In brief, it's a procedure in which bone cement is placed in a fractured vertebra using needles. So during the procedure, I misunderstood the length of such needles and placed one in a position where it could have lacerated the cava vein. As soon as I realized the mistake, I immediately removed the needle, and then I spent the longest 5 minutes of my life staring at the parameters with the anesthesiologist to check whether the blood pressure remained stable. My guardian angel was for sure looking down because I was so lucky that no vessel was damaged. But I definitively had the feeling that I used my wild card there and that I will never be again so lucky in the future. Anyway, now I am super careful when doing this and keep telling this story to my residents to teach them. Story 55. My BLL is a nurse anesthetist. Once, he told me a story about how his day went. He was scheduled to put a little girl, 6 under, for some dental-type procedure. When they spoke with Dad, things were normal. Typical questions. Has she eaten anything today? No. While the nurse was with the girl getting her ready, she said something offhandedly like, maybe get a special lunch later for being a big girl, or something else just meant to be supportive. That's when the girl told the nurse that she wasn't hungry because she ate eggs for breakfast. So that was how my BL had that case canceled for the day. Your kids are generally honest and they will spill the beans on any lie you tell about them, so just don't do it. Story 56. My grandfather's friend needed to have his leg amputated. Somewhere between him leaving the hospital bed to go into surgery and coming back out, someone had mislabeled the leg and they amputated the wrong leg. He went back into surgery 3 days later. He's very old and they were worried about him going under once, let alone twice. And they removed the other, correct, leg. This is one of those stories that I couldn't believe until I actually met the guy and realized he really does have both legs amputated for no good reason other than negligence. Story 57. Heard a story about a chiropractor. Man comes into his apt and didn't put on his information forms that he had a metal rod in his neck. Of course, it's not the chiropractor's fault that man didn't put down much needed information, But it's still a mistake, as he should have asked anyway if there was any major medical history. Long story short, the chiropractor cracks the guy's neck. Chiropractor kept his job due to having proof to it being patient negligence, but I don't think he kept the job anyway. Accidentally killing someone's got a weigh on you. Story 58. Not a surgeon, but when I was a nursing student, I was on theater prac. We had a guy in who needed humerus and elbow repair. I was pretty useless in everything but emotional support, as I wasn't qualified, so was chatting to him before he went under. He admitted to having an unhealthy substances habit. I informed the surgeon, who shrugged it off. Apparently, I should have told the anesthetist, because this dude woke up mid-surgery and was trying to reach for his open arm that the surgeon was working on. Super oh crap moment as we scrambled to contain this guy's arm and stop it from touching anything sterile. Story 59. Obligatory, not a surgeon. I was in OT as a second assistant. I am fairly tall person, about 5'10", and the first assistant about 5'2", 5'3". Surgeon about 5'10", 5'11". Surgeon was not happy with the lighting on the surgical area. He kept on repositioning the OT lights, and suddenly he accidentally hit me in the head, broke my glasses frame. I scrubbed out, put a plaster over my glasses frame, and got back assisting the op. Surgeon was apologetic. Can't remember how many times I was drowsy after a long night shift and assisting in the OT next morning. Story 60. My doc misdiagnosed a burst appendix, nothing life-altering, but I was in the hospital over a week while he tried to figure it out, but years later learned he was just covering for a potential lawsuit. Story 61. Not a surgeon, but will share a story I know. Back in the 80s, old lady got the wrong hip replaced. Furious, she yelled at the surgeon on the first visit. He calmed her down with, "We had to do it in this order, the healthy hip first, then the problematic one after a couple of months. Otherwise, you would have trouble walking after the right hip replacement." Remember, that was pre-internet days, and the surgeon never got any trouble for it. Story 62. I am not a surgeon, but I'd love real answers too. I feel like most surgeons won't admit to making mistakes, though. I'm hoping to hear like, oopsie daisy took half of their L front lobe instead of the full occipital lobe. They were fine, though. Story 63. What about when they're asleep? I woke up during surgery. I was paralyzed and couldn't open my eyes, but I could hear them debating about whether to go after something. The surgeon decided the object was too close to a nerve and decided to leave it. I asked about it after and was told I was hallucinating. I still have that little souvenir encysted in my face. It caused horrible neuralgia for years. Story 64. Not a surgeon, but I used to work in the OR, and there have been a number of stories. Removing an elderly patient's peenie only to realize he didn't have penile disease. Finishing up a hip replacement surgery. But then something popped and they had to redo the whole thing, having two separate patients almost slip off the OR bed because it wasn't secured properly. Story 65. Not a mistake, but for the operation on my knee, all the other surgeons were wearing these little covers over normal sescorts. Mine came in wearing wading boots. I went from terrified to horrified. Anyways, the surgery went great, and I can almost kneel again. Story 66. Patient here. Had a doctor call for more anesthesia during surgery at dangerous intervals, which lead me to being re-intubated and waking up almost 8 HRS after surgery was done.